Hi everyone, I'm a scientist at Helix, and I'll be presenting our work comparing monogenic and polygenic risk for 3 actionable and clinically important diseases. In the last couple of years, many studies have developed polygenic scores for breast cancer, colorectal cancer, and hypercholesterolemia. And they've shown that in some cases, a small fraction of the population with high polygenic risk has a similar lifetime risk compared to people with monogenic risk. However, fewer studies have actually looked at the age of onset or directly compared people with monogenic risk and polygenic risk in the same cohort. We focus on that question by collaborating with the Health in Nevada project. This is a project that has 40,000 adults research consented, and for all of them, there's Exome Plus sequencing information, which allows to look for pathogenic variants in exons as well as calculate genome-wide polygenic scores. Phenotype data was available from the medical records at Renown Health in Nevada. And for the genetic side, we followed the ACMG criteria for the monogenic variants, and we used published and validated polygenic scores. And importantly, for each individual, we compared the score to other individuals with the same genetic ancestry. Here I'm showing the results for women based on their genetic risk for breast cancer. In red, you can see women with an average polygenic score between the 40th and the 60th percentile. And you can see the lifetime risk is about 12% for breast cancer. In light blue, you can see women carrying a BRCA pathogenic or likely pathogenic variant. These women have about 70% lifetime risk. And importantly, the age of onset is much earlier compared to the age of onset of a woman with an average risk. Lastly, women with a high polygenic score in the top 5%, but that do not carry a BRCA pathogenic variant, have an increased risk for breast cancer, but this risk is lower than the risk compared to women with a BRCA variant, and the age of onset is later, which leads to, when you look at the hazard ratio compared to the woman with an average risk, hazard ratio of 2.5 in a woman with high polygenic score, and a hazard ratio of 10 for BRCA carriers. So in summary, a high polygenic risk for breast cancer is not the same as having a pathogenic or likely pathogenic BRCA variant. This is really important when implementing this in the clinic in the future. And you can see our results for colorectal cancer and hypercholesterolemia in details at helix.com/early onset.